Hello, everyone. I'm Michael Serapio. The federal government unveiled its next steps to expand public dental care in this country, beginning with seniors this month and into the new year, children under the age of 18 by June, and everyone else by the start of 2025. Now, there are guidelines as to who will qualify, but the government estimates upwards of 9 million Canadians will benefit.
I was talking with a group of seniors who said to me, Mark, this isn't really going to happen. I've had the same dentures for decades, literally, and I don't have the money to replace them. And when I said, no, this is real, it's going to happen. One of the most powerful moments for me politically, in my political life, to see that look of optimism and joy and what that dignity would mean, the dignity of being able to get those dentures replaced.
Well, of course, that was Mark Holland, the Federal Minister of Health, and Mr. Holland joins us right now. Minister, thank you for taking the time.
Thanks so much for having me, Michael.
Listen, your government has earmarked billions of dollars to make this dental care program possible, at $13 billion across 5 years. Is that money a good investment for this country? And by that, I'm kind of wondering what the cost-benefit analysis is here when you talk about dental care versus perhaps just putting that money into healthcare in general.
No, you bet it is. Oral health is health. And one of the things that is so remarkable to me as I go around is how important a healthy smile is to folks. It's not just important as a sense of dignity and a sense of confidence as you work, go into your job or you're meeting your life, but also, and I think this is so important as a tool of prevention. When I talk to healthcare professionals who are seeing folks in hospitals and emergency rooms who have to wait until their oral health problems become so terrible that they have to go in for surgery. The cost of that on a society, and the cost literally in terms of the cost to our healthcare system, is totally unacceptable. And we also know that having poor dental health can lead to cardiovascular disease, it can lead to diabetes, it can lead to a myriad of other illnesses. I talked about, meeting seniors, and some of them, all too many of them, have had the same dentures for decades, and, don't have the dignity of being able to scrounge the money together to get those new dentures into their mouth. So there's also just a fundamental issue of social justice here. I think this is going to be really transformational for our health system.
Okay, transformational, but there are right now other programs. Federally, there's the non-insured health benefits program. Provincially, there are also targeted programs. How will this national dental care really be different from what those provide?
Well, the idea here is to fill in the gaps. We're going after those folks who don't have coverage today. So we know that there's about a quarter of Canadians who have said that financial barriers means they're not getting access to oral health. So what we want to do is not displace what's there, but rather go after those folks who don't have service so that everybody has access to a healthy, happy smile. And as I say, that is not only going to be so important for how they inhabit the world and go into their work and spend time with their families and friends, but it's going to be so essential as well from a perspective of prevention. And so it's this plan is really going to work with the provincial and territorial plans, work with the other plans that are out there from other insurers to complement it, to fill in those gaps, to make sure that everybody has access to good oral health care.
Okay, you say work with, but I wonder if this program will, at the end of the day, for example, encourage provinces to divest from their own programs.
No, I'm having a lot of really great conversations with my provincial and territorial counterparts. And, when we were in Charlottetown, as an example, for the health ministers meeting, talking about how we can work together to improve health of Canadians. And it's so important that, we not look at this as an opportunity to slough off costs to another government or play a shell game with one another. We have to go shoulder to wheel to get this done. It's going to require every province and every territory setting aside differences, setting aside ego, setting aside jurisdiction, and being singularly focused on the health of Canadians. That's how we're going to deliver the best healthcare system in the world. And I know that that's what Canadians from coast to coast to coast expect us to do. So, I've been very encouraged in the conversations that I have that provinces aren't looking to play games with this, that they're looking to really go shoulder to shoulder to get what's needed done to make sure that people who don't have coverage get coverage. that if they're going to make additional investments in their health system, that those be additive, not reductive, not some way to cut corners and put money into their pocket, but instead making sure that they expand service. Canadians deserve that, and I think Canadians will be walking very closely. And I can tell you that the conversations that I've had with provinces and territories have me firmly believing that we're going to continue in that spirit of mutual cooperation and forward movement.
Okay, forward movement, filling in the gaps here. But, I also wonder, do you run the danger of highlighting or perhaps exacerbating regional or societal disparities? Because, it might be equal in theory, but unequal in practice, since really there's not many dental clinics in more rural parts of this country. Not everybody gets the same level of dental care. Are you worried that you're perhaps furthering inequality by introducing this program?
No, and I'm not, because of two very important factors. One, today we're talking about some 9 million Canadians who don't have access to oral health care and are going to get it. And that is huge. That's going to advance social equity enormously in this country. But we're not done there. We have the Oral Health Access Fund. The Oral Health Access Fund is so important at getting exactly what you're talking about. We know there are rural, remote communities, Indigenous communities, persons with disabilities. There are people who have extra barriers to getting to care. And that's why with the Oral Health Access Fund, we've set aside dollars to go after those problems. Now, Michael, that doesn't mean that this is going to be perfect out of the gate. It means that we're going to have a lot of continual work to do. But you don't allow perfection to be the enemy of progress. We need to make sure that we continue to have a society that is more just and more fair. And the way that we do that is one step at a time. I call it radical incrementalism, to make things better as fast as you can, as reasonably as you can. And there's no question that this announcement today is going to expand equality, is going to expand equity of outcomes, because that's really what we want to see happen here across our health system. It's not just about equality of access. Our eventual goal is equality of health outcomes. That's a big goal, but I think it's important to put it out there because that's what we're driving towards.
Okay. Well, listen, before you go, I do want to ask about pharmacare. Of course, the supply and confidence agreement won't fall because of it, but your NDP critic still hopes that a bill might be introduced before this week is done, which leads me to the question, will you be Santa Claus this week?
Well, I really have to say the conversations with Don Davies, who's the NDP health critic, have been very positive. They've been extremely productive in recognizing the circumstances that we're in, the needs, and kind of balancing all the different aspects. We're not there yet. It's my hope that we can be. We're obviously going to keep working right up to the last minute. But it's important first and foremost, and Don said this today, and I completely agree, that we get it right. This isn't about an arbitrary date and time. It's about getting results, and that's what we're focused on. And I can say that the conversations have been very productive, and so I remain hopeful that we're going to be able to do something soon.
Okay. Minister Mark Holland, thank you for this. Appreciate the time.
Thank you so much, Michael.